Hey guys, Luis Moreno here with Think Medicare, Think ACA. I'm glad to be back. I have been out on vacation. Man, I decided this summer I'm going to travel, and I've been traveling, so I'm trying to do the best I can. I got one more week of traveling, and then I'm back to normal, guys. We're going to keep this every single Friday. I'm glad for you all that are joining us. I appreciate you all being on here. All right, so we are 7 weeks away from Medicare AEP. Okay, that puts us October the 15th. Now, we get into ACA OEP, and we're about 9 weeks away from all that. So we are very close to the busiest time for us agents, and we've got to be prepared. So the first thing I'm going to do is we're going to talk first about being prepared for the Medicare AEP. All right. So one thing I want to tell agents, because I'm still working on this, I've been gone so much and been in some areas where I don't even have internet connection, is make sure that you have done your AHIP. Okay. Your AHIP is your Medicare 101. Okay. It's a beast of a course. It is a 5-module course, and you've got to score 90 on the test. So you're going to have a 5-question test. Okay. I'm not sorry, a 50-question test, and you can only miss a maximum of 5. Score 90, you pass. Under that, you're going to come out short. You're going to have to retake the test. So a couple of tips on that: save the modules. Okay, put all the modules into a folder on your desktop and access them. Try to research your questions as they pop up on as you're doing your test. Second thing is all of your quiz questions. Make sure that you're saving those too. Okay, that's also very, very important that you've got that done. Okay, and that way you can use them as a reference. All right, once you get your AHIP done, then it's not over, guys. You have to go to every carrier that you are contracted with, that you are selling, even if you're not going to sell with them, even if you're retired and you're just going to live off the renewals, make sure that you get certified for the following year with them. So you're going to go to each carrier and you're going to complete carrier certification. Now, one thing that I will do, and I can share this with y'all, give me 1 minute, is you got to find a way to track your carrier certifications. It's a little nuts. I created a little spreadsheet. I can share this with y'all, but 1 year at the very, very last minute, I forgot to certify with one carrier. Luckily, I caught it, but had I not caught it, I would have lost about $1,000 a month. It's a small carrier for me, but still, that's $12,000 a year. I'm not going to throw away $12,000, all because I forgot to certify. And I was saving all of my certifications on the sticky note. So I put on my carriers, and I was putting checks. Man, there's got to be a better way. So I'm going to share with you. Let me just get to my share screen here, and I'm going to share with you guys what I came up with. And if you all want it, do me a favor, guys, on the comments, just put on there, well, I need your email so that I can share it with you. Better yet, here's what I do. Ivan, can you, I'm going to share this document with you. I believe you may have it. Will you make a template and then put it on Google on our drive, and we can just share it with everybody who needs it? That might be a better way to do it. Okay, I'm getting there right now, guys. But this is what I am doing. Share. Oh, I got too many windows open here, guys. Sorry. Present. Sometimes my screens don't work like I want them to. There we go. Now I got to present. Share screen. Okay, here we go. Okay, got it. All right, so here's the screen that I'm sharing with you guys. So what I did is I put on my carriers. I put the date that I completed the certification. You'll see here I'm still missing 1, 2, 3. This is Aetna, CVS, which I don't think they have a separate one, but I can't remember. They do this once a year. You put all your carriers on here, guys. The date your certification. You want to make sure that you get your ready to sell confirmation from the carrier. Maybe you call to confirm if you were set up, and just put them on here. Make your list. So if you want this, guys, just do me a favor on the comments. Post a comment on there and say, hey, I'd like it we are going to create, let me stop sharing. We're going to create a template of this, and I can share it with you. So make sure that you're set up. Second thing for Medicare AEP that I will tell you guys, super important for you guys to do, is make sure that you're going to the rollouts. Look at the first looks, guys. We have a lot of changes happening in 2025. They are saying that this is going to be the year, the year that we have the most shopping from seniors. Why? Because of all the changes on PDP, on the prescription side. If you don't know what's happening, guys, it's very, very simple. On the prescription side of the house, we had 4 stages. We had the deductible, the initial coverage, the donut hole, and catastrophic. Well, they've gotten rid of the donut hole in 2025. A little bit easier, okay? The donut hole in 2025 was about $8,000. It's gone down. There's no donut hole, but there is a maximum spend and out of pocket on the prescription side for this that's dropped down to $2,000. That just if you do math, it's an approximate $6,000. Okay, that $6,000 is being pushed to the carriers. Government's not paying for it. The carriers are going to have to figure it out. So if the carriers now have an additional cost, these carriers, they want to make money. What they're going to do is they're going to make changes to plans. They're either going to do more co-insurance on the prescription side. They're going to lower benefits on the additional benefits on the medical side of the house. They're going to add premiums. So there's going to be a ton of changes. So you've got to be prepared and ready to go to help your current book. So it's a good way. If you're going to fall asleep here and maybe not be so active, you're going to lose out, guys. Your book is going to go somewhere else. So you want to make sure that you're maintaining your book, but it's also a great opportunity to grow your book. So get out there and tell people that you can help them out with their 2025. Also, we're in August. Here in a couple of weeks, our seniors that are on Medicare Advantage plans and PDPs are going to be getting the annual notice of change, the ANOC letter. Okay, this is going to let them know what's going to happen to their plan next year. So you can do post social media. Hey, seniors, you're going to receive this. Call me. I'll go over it with you. I'll explain it to you. It's going to be a great opportunity to review it with them and possibly say, look, I can help you out. I may have a better plan. Of course, you can't do anything till October. On October the 1st, you can go over the details of the plans. You just can't take any applications, but you can line up your appointments for October the 15th. Okay. All right. So it's going to be exciting. It's super exciting. All right, guys, do me a favor. We're trying to push this out to as many people as possible. Will you click the thumbs up? Click on the thumbs up. That's going to help the algorithms push us out to more people. So do me a favor. All right, Marshall, great question I see on here. I've been doing AMA for 3 years, but this is my first year doing ACA. Any advice? Yes, I've got some very, very good advice for you on this one. Okay, but, well, you know what? Let's just answer this question right now. For those of you, ACA, maybe you're a Medicare agent. You've been hearing ACA. I have some agents call it ACA. It's Obamacare. It's all the same thing, guys. It's health insurance for people that are under 65. A couple of changes that are happening to the under 65 market. One of the things, guys, is we're losing the 364 days of short term. So they're making it, they're on the short term under 65 world. What's happening is if they didn't want to get into an Obamacare, an ACA plan, you could get them a short-term plan. Now with the new rules that are going to start September 1st, they cannot get a plan no longer than 3 months. So for example, if they go with United, they can get 3 months. They can go with another carrier, get another 3 months. They can go with another carrier, get another 3 months. If they want to go back to United, they can only get 1 more month with United, and that's it, maximum of 4 months. But what's happening is every 3 months that they're getting a short-term plan, they're going to have to reapply, and they're going to have to prove that they're still healthy and have no pre-existing conditions. It's going to be tough. And what a pain to do it every 3 months. I think because of that, we're going to have a stronger ACA market or opportunity. So any advice for the actual advice for ACA? Guys, we love ACA. I love it. It's the primary driver for all my other lines of business in the agency. So number one, and I tell agents on this, if you're already set up for ACA, the key issue to being successful is where are you going to get clients from? That's the biggest thing. Okay. I think you should get out there on social media. So on the back up, there's two ways to get clients: the slow way and the fast way, hunting versus farming. And I think agents need to do both. Okay. Not just one. So let's go over the slow way, the cheap way that doesn't cost you money way. It costs you a lot of effort way. And that is going out there and doing grassroots marketing. Okay. It's like, it's farming. It's planting the seed and watering it and just wait for it to sprout. So you've got to get out there and create your centers of influence that are going to send you business. So get out there and market with your go talk to your P&C guy, the person who insures your auto, your home, or if you're a renter, your renter's insurance. Go talk to them first. Hey, what are you doing with all your people for ACA? Can I help? Hey, work out a split with them. They're licensed. You can share commissions. Okay, that's number one. Go talk to your P&C guy. Go talk to your tax preparer. Okay, that's another one. Your CPA, your whoever handles your taxes, go talk to them. Okay, and just don't talk to them. Talk to other people that do taxes. Don't just talk to your own P&C guy. Go talk to other P&C guys. All right. What about doctors? Go stop by a doctor's office. Hey, what are you doing with your people that don't have insurance? And what about the people that have insurance, but they have the wrong plan and they want to see that doctor? But what I mean by the wrong plan, a plan where that doctor is not in network. Hey, I can help. How can I help? Well, if you send me people, I'll make sure that they can get enrolled in the plans that you guys take. So go get set up with them. Okay. Secondly, okay, so that's the farming side. The hunting side costs money, and that's social media. Get out there and post on social media. You can do post, and then you can do paid or sponsored advertising. That's what's going to cost you. Create ads out there for ACA. We have some very, very good processes for that. Why we've been very successful. We wrote over under 1,700 apps last open enrollment. And it was because we ran ads. Those leads that came from the ads automatically got entered to my CRM. Once they were entered to our CRM, they got warmed up. They got emails and text messages. And then we were able to connect with them immediately. Within minutes, we were calling them. And we weren't manually calling them. The CRM was connecting them. The CRM would call me. Hey, you want to talk to this lead? I hit a number. It'd call the lead, connect us, and then that phone call would be recorded. Hey, John, you just clicked on my ad and you want some information on health insurance. How can I help you? And you're catching them right there. Okay. If this happened late at night and you weren't able to do it, well, at least they got some emails and some text messages from you letting them, excuse me, I'm having trouble breathing again. Okay, so I would do that. Also, Marshall, make sure that you have your intake sheets ready for ACA. Okay, that way you can capture all the data. Second thing is make sure that you have the processes done to collect the permission to search, your consent form and your confirmation. Do not screw around with it. I know agents are doing that right now, but we're doing business for the long haul. Make sure that you collect consent before you do a search. So if you're using Health Sherpa, which I think is the best tool out there, you can quote, you can collect all the data from the insured, get it all done. Make sure that you enter, that you do your doctor search, your prescription search. Once you find the correct plan and you hit add to cart. So a window's going to pop up. You can, before you do the search on Marketplace for them, collect the consent. Now, the way we do it is I use Agent CRM. Okay. I use Agent CRM and I enter if it's a lead, all their data is already in there. So I send them I click on a button, hit save. a workflow goes into action. It sends them the consent form. It's going to send it to them right now by text or email, whichever one I select. They view it, they read everything on there, and they reply back with I consent. We are now creating the very same form where they can sign it. Okay, so I think the signature is better. We're creating that, but you can also collect it via text. The email that I received, the bulletin from CMS, says that we can collect consent by email. Okay, we can collect by text message, a wet signature, an electronic signature, and by voice. Okay, recorded. Okay, so you can do that. Okay, you get all that information, you collect the consent, you're rocking. Now that you collect all that consent, you proceed, you go through your entire application. Right before you submit it, there's a page on Health Sherpa that says finalize. You can print that finalize, save it as a PDF within your agent CRM or whatever you're using. You email it to them and you tell them, look, please review this. Make sure that everything is accurate. And if it is, reply back with I confirm. Beautiful. Now you captured the ACA consent and the confirmation. And I've done it where I typo and they're like, oh, you misspelled the street. You didn't get the apartment number. Something is off. You can easily go back, make your corrections, and then you can submit it. You get hopefully you get your eligibility and your subsidy for the clients, and you proceed and you enroll. I would say that's number one. Make sure you do that. Don't cut any shortcuts. If they don't give you consent, don't write them. Move on. They have to do that. All right, so I hope that helps you out, Marshall. Here's the other deal on the CRM. Okay, if you don't have a CRM, check this out. I am going to share. Let's put this in there. Let me go to. You know what? I've got it right here. Here is the link. Grab this link, guys. If you do not have a CRM, we are building out some incredible tools for people right now. Okay, use this link to get a CRM. You must have a CRM, guys. It is the hammer to a carpenter. It's a paintbrush to a painter. Okay, you gotta have it. I don't know how somebody can do their job without a CRM. And if you're thinking, well, why do I need a CRM? Guys, it's a tool. Okay, number one, a lot of you guys probably have not been sued by an insured. I've gone through 3 of them and they suck. It's a time suck. It makes you want to get out of the business. You can't believe what the insured is doing to you. You have to, you're guilty until you prove yourself innocent. Okay, that's the mentality that you need to have. Our clients will throw you or any agent under the bus to save their skin. Live like that. Function like that. Don't trust. I'm with 25 years. I've learned. If it's not in writing or if it's not recorded somehow, it didn't happen. So make sure that you document everything. The best way to document the CRM timestamps everything. You can record your phone call. It'll timestamp your text messages and your email. So it's a great way to prevent E&O issues. Okay, it won't stop a suit from happening, but you can shut it down. They can allege something, and then you can, nope, I did do this. Here's a recording, and it shuts down, and you can proceed. But when you don't have something, what you're doing is you're tying the hands of your attorneys from the E&O carrier behind their back, and you're going to force them to settle. And now you got an E&O claim. You're like, well, so it didn't cost me anything. It's going to cost you in premiums the following couple of years, and they may even drop you. So I would just tell you, don't do it. Just prepare yourself. So that's one side of the reason why you need to have a CRM. The other side as to why you need to have a CRM, it's a tool. It's a multiplier. It's a force multiplier. Okay, so what we do is we've created a bunch of workflows, and on these workflows, what it does is when you enter a client or a contact, there's workflows for all kinds of stuff. So I'm going to go back to Marshall. Let's say that you add 200-300 ACAs OEP. There's a workflow in my CRM that when you enter those contacts, if you put the date of birth in there, it's going to notify you when they're 64 and a half. That is a turning 65 lead for your Medicare business. We get about 5, 10, it varies every week of people turning 64 and a half in my agency. Now that workflow not only notifies you, but it starts sending them emails and text messages, and it starts prepping them for the insured to enroll. So go to security, get A and B, and then in fact, it worked beautifully for me this week when I was in vacation. I had a client said, "Hey, Luis, I followed all your instructions. I went and got my A and B. I'm ready. Can you help me enroll?" I'm like, how did I forget to call this guy? I enrolled him. I did my recording. It was so easy, all because of my workflows. So again, Marshall, make sure you have a CRM. If you don't, use mine. All right, let's proceed. Okay, Matthew. Oscar is one of the 2 carriers I sell in my county that pays a commission. What advice? Oh, it sucks, man. God, I hate the fact that they're falling off Health Sherpa. And here's what I know. Okay, I guess Health Sherpa makes money from several ways. Number one is when you don't have a carrier, you refer it, they pay you a referral fee, but they get to keep the commissions and the bonuses. So they make money that way. The second way they make money is in order for a carrier to be quoted on their platform, they have to pay Health Sherpa. Well, Oscar decided this year they're not paying Health Sherpa. Health Sherpa said, "You're out. We're not going to put you on our platform." So what do? All you can do is maybe look at another quote platform. There's Insura. I don't know anything about them. I don't even mess with them. Or you're just going to have to go directly to the hioscar.com, log in, and do everything from there. God, but that sucks. I can't think of any other way to help you out on that one, Matthew. But one good thing to possibly do is maybe talk to your local rep and say, "Why did you guys not pay Health Sherpa and get on their platform? You know how hard you made this on us?" They may or may not care. Man, do I wish I had a better answer for you. All right, let's continue, guys. So I tackled Medicare certification, carrier certification. Make sure you do that. Make sure you apply it. Here's another thing, guys. I'm going to go back to my CRM here. Okay. All right. Let me share with you. I'm going to share this with you. Check this out. This is what we are building out right now. All right. Here we go. So you go on here, and this is me, guys. All right. So you go in here and you enter some information. Okay. All right. Look at these tabs up here on the right. How cool is this? Okay. You see this? We are creating these tabs for you guys to use. When you sell a policy and you click on it, look what it does, guys. You're able to select who submitted it. Then you're able to go on here and select the product. Then you'll select the carrier, and all this will get pre-filled. As you're doing this, it's going to do a bunch of stuff for you. It's going to tag them for you. It's going to put them into the appropriate workflows for you. And all you've got to do is put policy sold and select the product that was sold. We're also going to have canceled. Okay, this is pretty cool. Okay, so we're going to be able to put the request here, but this is what's so cool about a policy cancellation. People will leave you for whatever the reason is. Okay, it's not that they're bad people, but maybe your rates went up. Maybe they got a better deal. Who knows? But what's going to happen is when we go in here and we get this policy canceled hot button worked out, you're going to be able to X-date this. So what I tell my staff is, look, if they leave us, hey, we're sorry. Thank you for letting us know. We loved you. Thank you for having business with us for all this time. By the way, look, if it's an auto policy, they renew every 6 months. If it's a home, it's every year. Would you mind if I call you a month before your renewal? Because you're going to find out then maybe these carriers have great teaser rates and then they increase so much. Maybe your rates get better. Who knows what the scenario is? Can I call you and a month before your renewal, you should have your renewal docs by then. Let's compare. Maybe we can get you back. They say yes, then we're going to have, once you've entered all this data, you're going to have a calendar button that pops up so you can schedule an appointment to call them back. How cool is that, guys? So we're building out a bunch of buttons here for you. We'll probably have the Medicare button here for you. We'll have the Health Sherpa button so you can quickly access it. We're thinking of all kinds of buttons to put on here so you can have easy access. Again, we're trying to make Health Sherpa, or I'm sorry, Agent CRM an invaluable tool. I would tell you everybody in my office has it. All right, guys, I need a couple of things for you. Click on the like button. Okay, do me a favor. Click on the like button. Okay, I would appreciate that. Okay, if you would do that for me. All right, make sure you do that. That'd be great. Click on that. If you're not a subscriber to my channel, get on there. I'm going to be having more of these open mics during the AEP, OEP. I'll be here waiting for you to ask me questions. All right, let's continue. What else do we have, Ivan? Okay, we got Matthew. Thank you, Stephen. Yeah, Stephen uses this thing all the time. All right, any other questions, guys? Hit me up. I'm going to do a couple of topics. Put your questions on here. Thank you. Thank you for the love. It's nice sometimes to have that love. Super, super nice. All right. Know that, guys, if you're doing Health Sherpa, if you're running ACA quotes, if they already have an agent, this is a double-edged sword. They made it harder for agents to change the agent of record, which I think is great. We used to have two ways to do it. You could email a link to the client so they can complete their app online. They took that away. Now you have to do a three-way call with the marketplace. And it's not good. It takes about 30 minutes. They go through every single question. They're slow, but that's the only way to change the agent of record as of now. How were they going to handle the volume during OEP? It may be hours for you to change the agent of record. What a pain in the butt. Hopefully they come up with a system, or hopefully they staff up. But it's going to be a mess. And I wish I had some experience on that. But I don't, because this is the first year that they're implementing this. So we'll see. All right. Let's post. Ivan, can you post Pashan's question there on the board there? Okay, so the new ACA process, if a couple is married but they file taxes, they do not qualify. That is correct. Guys, so if you're doing ACA, part of your intake, where you're collecting all the data, is to ask them, how do you file? Who is on your tax return? What is your tax family? They don't care about the physical living arrangements. You can have your sister living in your house with all her kids, grandma, whatever. In the application scenario for Health Sherpa or for ACA, the only thing that matters is the tax return. Who is on your tax return? If grandma's not on your tax return, we don't care. Don't insure her. You can't insure her. So here's what you end up doing. What you end up doing is you ask if if it's married joint, rock and roll. Let's say it's a joint, married filing joint scenario. Maybe one spouse wants to be insured, the other one doesn't. It's super easy to do. You just on the app, you put them all on there and you uncheck who wants insurance and who doesn't. Easy. But if they file separate, even if they qualify, no subsidies. You can insure them, but they cannot get subsidies if they qualify for them. They cannot get CSRs, cost sharing reductions, if they qualify. Married filing separate. That's just the way it is. If they did take it, it'd be a great way to game the system. Okay. So for example, me, my wife, my kids, let's say that we did married filing separate. Okay. I would do mine, have all the income shifted to me. I'd have just the minimum income shifted to her. I'd put her with the 3 kids. She could get an incredible policy with the maximum subsidies, the maximum CSRs. But that's a scenario where I could game it. But because we'd have to file married separate, None of that's going to happen. Now, we do joint. So, Prashant, yes, if it's joint, they would qualify, assuming the numbers work out. But yes, they have to file joint. Or the other scenario is they file single or head of household. Now, again, remember, we don't care what they did in 2023. That ship has sailed. It's how they're going to file in 2024. Okay, and then for going OEP for 2025, it's how they plan to file in that tax year. All right, hope that helps you out. If not, re-ask the question. All right, let's go to the next one. All in red coaching. Luis, have you heard anything about the low income qualifier for ACP going away after 2025? I have not. So as of right now, guys, first thing is there is a low income qualifier for a monthly SEP. Depending on your state, it's either between 100 and 150% or 138% and 150, assuming that your state has Medicaid. But if they fall within that window of the federal poverty level, there's a chart that's in my smart book. In fact, I will share it right now. Okay, you should be seeing my federal poverty chart here. So if you look at this thing, anywhere between 100 to 150%, that is the low income qualifier that All in Red Coaching is referring to. Now, if your state has Medicaid, is between 138% and 150. Okay. Now, assuming you're within that range, then they get an SCP. Okay. And then you can enroll them. You can make them switch plans. It's just a special enrollment when you can do what you got to do for them. After 2025, who knows? New administration, we'll see what's going to happen. Here's my prediction. We get a Republican administration, probably not going to renew. We get a Democratic administration, probably that it'll renew. But that's just me with my limited political crystal ball that I have here. Yeah, who knows? All right, let's continue. Great question. Great question. But for now, guys, it's there for 2025. We'll see what happens. All right, let's go with Neil. Neil, okay. Are there any rules about offering a $20 Amazon gift card for every signed ACA contract that was referred to me to incentivize people to send you a referral? It's a referral, not sharing commissions. If you share commissions, they must be licensed. If it is a referral, rock and roll. Okay, so the one key qualifier here, it's based on the referral, not on the enrollment. Okay, which kind of sucks. But you know what? You can kind of play the game. Okay, so if you and we do it, we'll say, hey, anybody send us a piece of business, and hey, we'll give you a gift card. Just tell us where you want it. You want Amazon, you want Walmart, you want Starbucks. Hey, we'll do it. We'll send you. Thank you for sending business to us. So, yeah, you can take advantage of it. Sure, why not? Okay. Now, if it's Medicare, no. Medicare, well, you know what? I take that back. For Medicare, and I haven't seen any data on this, but we're able to offer a $100 referral for an MAPD and a $25 referral for a PDP. As far as I know, that's still in effect. Okay. But for ACA, and you did put ACA on there, you should be good to go. Very, very good question. All right, guys, don't forget, make sure that you like this video. It helps us grow this thing. The more questions, I love questions. I hate yapping away just with me thinking of stuff. All right, post anything you got. All right, let's continue here. So I'm getting a ton of emails from carriers right now on first looks. A lot of first looks out there. Okay, start getting yourself familiar with what's going to happen in your area with 2025 plans. Okay. Now, I just mainly sell in my area. But if you got to go to, if you sell across the state, maybe you're in multiple states, you've got to have an enrollment tool. Okay. I use a tool called Sunfire. Okay. Very, very good tool. Okay. I'm going to share the screen here on what Sunfire is. And I'm thinking what we're going to do, guys, is on Agent CRM, I'm going to put a hot button for Sunfire. Right now, I've got to go to tab and open it up. No big deal. But what Sunfire is, and there's Connecture, all it is they're tools to help you quote and enroll. So you're going to be able to search your contacts. Here's what I like about Sunfire. Forget the search contacts. You are able to do your SOAs here. So you can send a scope to your clients. So this is we're now shifting to Medicare, guys. Remember this, these rules have not changed. You have a 48-hour SOA rule. It's not a 2-day rule, it's a 48-hour rule. So you get the SOA, you either email it to them and they sign it, you text it to them and they sign it. You get them to sign the scope in front of you, assuming it's a walk-in or whatever it may be. They sign on your device, or you have a paper where they signed it and it's a wet signature and you're going to upload it. You can also, if you start this dialer, you will get the ability to get a voice SOA. 48 hours from the time that you collected it, unless there's a few exceptions. There's an exception for a walk-in, a call-in, or if a valid election is going to end within 4 days. Those are the exceptions. Otherwise, you have to wait the 48 hours. So it's 10 a.m. right now. 10 a.m. tomorrow would be 24. 10 a.m. the following day, which is Sunday now, would be the 48 hours. Make your appointment for 10:30 on Sunday or later. Don't do for 9 a.m. Sunday because you haven't met the 48-hour rule. Okay. All right. So that's your SOA. You can go back and you can do your quote and enroll here. You put your zip code. I'm going to just do zip. Okay. MAPD, enter docs. You can enter meds. You can go to work here. Now, this is just going to give us 2024 stuff, but 2025 stuff will start populating sometime in October, I believe. Okay, you'll start getting all your stuff here, and you can do your thing. Sunfire is a great tool. You can pick your plan. You can enroll them. I like it. All right, let's get out of here. All right, so we got Sunfire. So check out the first looks from all of your carriers and see what the major changes are. Okay. I haven't dived into them yet. I've been gone, but start diving into them and see what's going to happen to your book of business in your area. Ivan, you see any other questions popping up? Again, guys, do me a favor. One thing I would like on your comments, we got 23 of you on here. We got 24, 25, whatever. Do me a favor. Where are you guys from? Just post the state. Just put on there, hey, Texas, whatever. Do me a favor and just put, where are you from? I'm just curious, guys. Okay. All right, let's continue. Matthew, good question here, Matthew. A lot of regional carriers have the best MAPDs in my area. Ultimate, never heard of them. Freedom, never heard of them. I have heard of Devoted, yes. Okay. Can I contract with 360 for these carriers? Oh, hell yes, you can, Matthew. Go back to your contracting link and pick up those regional ones. If we don't have them, send me an email. Matthew, you're one of my agents. Send me an email, please, and we will definitely see what's going on. If not, you can probably contract with them direct. But yeah, get them, man. You don't want to lose out. Oh, great question. Cali, Wisconsin, Florida. Any Texas people besides us? Wisconsin. Man, I just came back from Utah. I was in Florida a couple of weeks ago. I was in Moab. Anybody from Utah? Man, I was in Moab. It was incredible. We were out there, and Moab's got this beautiful, delicate arch. Man, I wish I could show some of the pictures we took. But man, we We were walking by a 3-mile hike. We were going out there to get the moon on top of this beautiful arch, and there's a helicopter out there on about mile 2. Person died walking out there. Heat exhaustion. Crazy. All right. Anything else? All right. No. Okay. Thank you for putting on there. So a couple of states, you guys are all over the country. Any other questions, guys? I've got all my stuff, my little notes here that I had on things that I wanted to talk about. Oh, I am Mississippi. There you go. I do have, I get this question from you guys every now and then, and that is group insurance. If you happen to run into a group, hey, how do I handle group insurance? Group insurance can be very lucrative, guys. What I'm referring to as far as group insurance is a business who wants to offer insurance to their employees. Okay, it's expensive for the employer. Marshall, this is also another good thing for you if you want to get out there and market. Go walk and talk. Stop at the strip center. Okay, start on one end and go to every business. Okay, the Subway, Dairy Queen, that's local. Your whatever. Stop by each one of them. Hey, do you guys have group insurance? Most of them, most small businesses are not. Maybe it's an opportunity to talk to them about group insurance. If they say no, well, hey, no problem. Hey, do you know that I can help you at no cost to you, Mr. Owner, with your employees' health insurance? I can come in here. I can do a little lunch and learn. We can, and talk to them about Obamacare, and I can help them get insurance on your behalf. Then, if the employer says, you know what, that'd be great. I want to, I'd like to offer them $100 each. You can create an ICRA. It's a lot more stuff involved in creating ICRA. We have another organization that we partner up with that can help set it up for you. But now they can do stuff to offer their employees some money to help them pay for their health insurance. So, but I think walking and talking is great. It's hard. You have to have some thick skin, and you got to have that ability to walk in a business and say, hey, I'd like to talk to the owner about health insurance. Now, getting back to assuming they want group insurance. So you've got to find a local groups benefit administrator. Okay. They'll send you a census that they utilize. A census is just all the data of all the employees and who wants to get insured, company information. You send it in, they'll give you quotes, and then you go through your process. It's not easy, guys. It is not easy. So, but it's lucrative. Yeah, I make money on it. It's a lot of work. Hey, we got New Orleans in the house. Love going to Louisiana. All right, Marshall. Let's post Marshall question on here. Great question, Marshall. I have a referral partner who is a financial. I forgot about this man who can give me group referrals. Just haven't learned enough about it yet. I'll do it with the right training. Hell yes, you should do it. So a group. So they may be sending you a business. So what I would do, Marshall, where do you live, Marshall? What state are you in? I didn't see you post on there. Wisconsin. There you go. You're in Wisconsin. So find you a benefits administrator. There's a national one called Benefit Mall. Okay. Maybe you find it, but to me, when the national ones, you're not going to be on the radar unless you produce a lot. Okay. Maybe find you a regional one. I use a regional one here. Okay. Partner up with that regional one. Let them know, look, I've never done group insurance. In fact, what I do is I just collect the census. I send it to my contact at this regional one, and they do all the work. And I'm like, hey, help me with this. What my client wants this. She goes, well, Luis, here, do this. Let's look at these plans. She'll highlight them for me. She'll send me all the information. Then I contact my insured. We'll go over them. If they like it, maybe they say, I don't like it. It's too much. Or let's change this. I'm just going back and forth. I'm the middleman. Then when it's time to enroll and they've selected a plan, I just call my lady there at the benefits company here in town. I'm like, look, they're going to take this. She emails me an enrollment packet, an employer app, all the employee apps, or an employee app, which every employee, even if they're rejected, they have to sign it. She sends me a list of all the other docs I need to collect. I get all that done. I send it to her, and she goes to work for me, gets it all done. Now, I do give up a little portion of the commissions, but I'm willing to do that because I don't want to go do all that other work. Okay, so find you a benefits administrator in your area, Marshall. Partner up with them. They'll take you under their wing and help you out. Okay, it's completely different from ACA. And you can do this year round. Okay, year round. That's another good thing. Awesome. Okay. All right, guys. I just got back from Utah yesterday. I was supposed to be in Wednesday, but my flight got canceled. Not a good thing. But anyway, regardless, I gotta get caught up. And I leave Tuesday to the U.S. Open. I love tennis. I play a lot of tennis. I'm gonna go check out the U.S. Open in New York with the wife and a bunch of other couples that play tennis. So we're gonna go do that. All right, JP, where can I learn the new rules for ACA? You're looking at the channel. It's going to give you all the data, JP. Make sure you subscribe, because when there's something new out there, I'm doing a video on it. So, JP, you better subscribe, number one. Secondly, the only thing that has changed on the ACA side of the house, as far as compliance, and I talked about this earlier, is you must collect the consent and the confirmation. I know of agents that are getting or getting suspensions from the marketplace for not being able to provide this data when you are asked to provide it. So if you're flying by the seat of your pants, and you're just hoping that you never get a complaint and they ask for it, at some point you're gonna get busted. So the only thing that you need to do is you need to make sure that you collect that consent and that confirmation. Now, a carrier may want to say, hey, why, if they're complaining to the carrier may come back and say, why did you select this plan? Well, number one, if you collected the intake form and it's got the doctors and the meds, your answer should be very easy. Hey, I entered the doctors and the meds. This was the best plan for them. It had either all the docs or the majority of the docs, or maybe it had none and the insured still chose that plan because the premium was better. Again, remember, these insureds will throw you under the bus. So make sure it's documented somehow. Hey, I realize, Mr. Client, you're going to choose this company, but remember, these doctors that you gave me, they are not in that network. Send an email to them, a text message them, have them confirm it. If you're recording the phone call, well, then you got the data there. Okay, same thing on the meds. Okay, make sure you have the meds on there. You're checking. You're letting them know what tiers they're in, or if they're not covered. Make them aware of that. A lot of clients will say it's okay, but they'll gladly file a complaint to screw you over. And then you have to have your documentation that they said, okay, that's not a big deal. Okay, make sure you do that. Other than that, JP, there's no other rules you have to worry about. Nothing's come down the pipeline, but don't screw around with not collecting the consent and the confirmation. All right, let's go to Neil. Neil, can you tell me more about the ACA process when you get a lead on Facebook to when you call them? Do you use appointment setters? Do you have appointments only or dial new leads when received? All right. Here's our process. Have Agent CRM. Agent CRM, with the tools that I've created for me in my agency, which I then push down to you guys if you use my affiliate link. You already have these tools, but you need to make sure that your CRM, the workflow for ACA leads, points to the lead form on Facebook. Okay, you have to have the map. Okay, it's listening to it. You're like, God, that sounds complicated. Just jump on a support tab, Zoom with Agent CRM. They'll do it for you. Okay, you're going to have to open your Facebook. They're going to have to see where this is at, and they'll connect it. Now, once it's connected, that data that's on that lead form, which is you're collecting name, phone number, and email, that data gets automatically imported to your CRM. It's tagged, it's in there. Then what you do with it is the workflow is going to send them an email and text. Hey, Mr. Lead, you just clicked on my ad. Thank you so much. My name is Luis. I'm going to be calling you. I'm going to call you from this number, so be prepared. That way you don't think that it's a spam number. By the way, also know that I'm going to ask you for your spouse's information, your kids, financials. I'm going to need to know all that data so that I quote you accurately. Okay, that's it. I don't have appointment setters. That lead form that you create on agents on Facebook, after they've entered their data and they hit enter, it opens up a window for a calendar for them to book themselves. Okay, I don't quite like that too much because social media leads have a very, very short lifespan. Got to get them while it's hot. Okay, so get a hold of them, and you want to always do a one-time close. So you need to have your act together. One-time close. So you get them on the phone, have your intakes ready, start asking them all their questions. Now, the one thing I don't do is I don't ask for socials immediately. Okay, they're going to be hesitant. Remember, they don't know you. You're a complete stranger and you haven't earned their trust. They'll give you date of births, they'll give you all the rest, but they might not give you socials. So what I tend to do is I'll tell them, look, I don't need your socials now. Okay, let me earn your trust. Let me find you the right plan. But when I do the application, I must intro. The client will be, okay, no problem. Okay, remember, clients usually, they want help and they don't want to tell you no. But man, would you want to give your socials out to some stranger? Yes. So earn their trust, and then you can get it on the other end. Okay. Hope that helps you out, Neil. If not, hit me back up. Let's go to JP. Have you tried marketing your PURL? That is your personal URL from Health Sherpa. No, I have not. I don't do anything with it. I know it's there. Okay. If you're wondering what we're talking about, I'm going to pull up Health Sherpa. I got to integrate again. Give me a minute. Let me do that. Send the code. Here's my code. 83031. Okay. Amen. Okay. All right. So, guys, you're going to have to integrate. Just so you know, you're going to have to integrate your Health Sherpa every 12 hours. All right. Come on. Show my screen. Oh, here we go. Sharing my screen on Health Sherpa. All right. So here is my URL. My URL. Okay. I can take this, copy it, and paste it. And it has my NPN. Oh, you guys aren't seeing this. Share this tab. Okay, there we go. So I pasted my PURL. A client can go in here and put their information in. They can go quote and enroll themselves. You'll get an email from Health Sherpa that you got a lead. And you can do everything. They can self-enroll. I just don't do it. I guess maybe I should, but I don't. So you can definitely do that. Good question. All right, Anthony, what are your opinions on lead vendors? Ugh. Man, I hope that. Ugh. So here's the deal, guys. Tells you what I think of them. Lead vendors are in the business of creating leads and selling them to you. And not just to you, but to many other agents. That's how they make their money. So number one is be prepared to be competing with all the other agents they're going to sell these leads to. So that should be flag number one. Flag number two is you have no idea what they're using as bait to capture this info. They could be doing the crappy ads. Maybe they're incentivizing people to fill out information. Who knows? They're not going to tell you. They're just going to give you a lead. All right. So just those two things alone, and I've tried them, guys, leads me to the point of where I want to generate my own leads. Okay, social media. Guys, they're generating their leads from social media too. They are not doing anything else but posting on their ads on social media, capturing that data, and then selling it to you and a bunch of other agents. So you might as well do it yourself. Okay, if you do it yourself, you are rocking. Later today, I'm doing a video with Shauna on the course, or the Facebook course. There's two of them that I'm working with now. But you take your pick. But we are going to be having, let me pull this up here. If you have no idea how to, I'm putting this on, give me 1 minute. spell course. Here we go. All right, I'm going to share this right here, guys. Here is the course. I'm also going to put it on the comments. We'll be doing a video today at 12 about the course. Next week, the course is $14.97. Okay. Use my link. It's going to be $9.97 August. I think it's next week. Okay. But she will teach you everything about how to run a course, how to run an ad. Secondly, it will show, I add to the course on how to link the ad, the lead to agent CRM. Okay. I think the best thing you can do as an agent is run your own leads. Run them. She'll teach you how to run them for anything. If you want to sell widgets, you'll be able to do it. You just got to create your own ad copy. So there are my thoughts on lead vendors. All right, let's continue. Next one, Marshall. Just to be clear and make sure you understand, I find a local benefits administrator. Talk to them in person or give them a call. Yes, you can. And they will guide you. That is correct. Okay, Benefit Mall is a national one. I'm sure there's other ones. Maybe just Google benefits administrator in your town and see if something pops up. I use a company called Rogers Benefit Group. They switched to Emerson. Maybe look up Emerson Benefits, Benefit Mall, and just tell them I'm an agent. I need help with group insurance. And you're rocking. Next question there, Ivan. What about the pre-consent on a lead form? I don't know anything about that. I think that's a good one. If somehow you can collect it, I think you're referring to the pre-consent on the lead form in ACA for Facebook. I don't know. Ooh. But the thing is, I guess if it's a true consent where it's got all the information listed on there and somehow they sign it or confirm somehow, then maybe yes. Oh, that's another deal. You're right. I have a feeling here pretty soon that these lead companies are going to be out of business. How are they going to create leads for one agent? Forgot about that. So what I just said there about the lead vendors, that's now. But yes, you're right. Leads need to be specific. So I think some of these lead companies are going to go out of business. Otherwise, they're going to be running ads for you and charge you. I guess. I don't know. Very, very glad you brought that point up. Daily motivational quotes. I like that. All right, let's go to Neil. Should we set up a DBA and start branding our own rather than personally? I think so. Just think about this. Would you want to insure your car, your auto, and your home with John Smith, or would you feel better if it was the Smith Insurance Agency? Personally, to answer that, maybe that was a bad way to explain it. Ultimately, Neil, yes, go get a DBA. Very, very easy. Go to your county, search, think of your DBA. Mine's called Simply Health Insurance Agency. Get in there, make sure it's not owned by anybody, and go get your DBA. Secondly, remember, you're still a sole prop. A DBA is just doing business as. Then with your DBA, you would also go get your FEIN number. You can Google that. It takes you about 2 or 3 minutes, and you'll have your federal employer identification number if you down the road want to hire employees. And then with all that data, you can go open up a bank account with that employer information. So yes, I would much, much rather take it a step level and get it out of your personal name and get into a company name. Makes you a little more official. Good one. All right, Stephen, there's nothing like getting leads from your current insurance. Stephen's been a master of this. So I agree. Guys, every client, Ivan, and here's the deal. I know you're listening here, Ivan. We need to add a referrals hot button. Okay. So, yes, asking for referrals. Stephen, and maybe you want to follow him on Facebook. He posts several times a day, makes videos with his phone about ACA. all kinds of stuff. Sometimes he puts a piece of cheese on his head, which I still don't understand. Okay, but regardless, just make their post. He doesn't pay for them, but he gets referrals from them. You got to be very, very consistent. I like that, Stephen. Keep it up. Armando, is social waves lead marketing available for all lines? Yes. So she just teaches you how to run, how to create ads on social media. Okay. Once you know how to do it for your other lines of business, all you have to do is change the ad. So maybe you want to run ads for dental and vision, maybe Medicare, maybe auto insurance, home insurance, life insurance, mortgage protection, file expense, whatever it may be. All you've got to do is you can duplicate that ad campaign, change the audience, location, you name it, and change the ad copy, and you can proceed to something new, a new line of business. Great. Okay, daily motivational quotes. Here we go. Luis, if I sign up a beneficiary during open enrollment, will they be locked to me when I sign them up, or can they change during open enrollment? Okay, so open enrollment means two things for me. So post again here and tell me, is this open enrollment ACA, open enrollment Medicare, which is the first quarter of the year? Help me out here, man. The beneficiary, a lot of times that means Medicare beneficiary. So post again on there and tell me you're talking about ACA or Medicare. Or I'll just talk about both of them. So this ACA, okay, ACA open enrollment, guys. This starts November the 1st, ends January the 15th, 2.5 months. If you sign them up during the OEP, they're virgins. They do not have an agent. That's what I mean by it. You sign them up. They're locked to you unless down the road there's a valid election and that other agent steals them from you by making a three-way call to the marketplace. They can no longer do what they've been doing in the past, and that is opening the app and making some changes. That's what these rat agents were doing in the past. They post these clickbait ads. Let me give you $500. Let me give you a free trip. Let me give you $6,400 back. These rats were doing these deceiving ads, and these poor insureds were filling out their data or giving them their data. These rat agents would capture that data. They would go do a search without consent, or maybe the consent was somehow built in that all that fine print, and they'd search the client, and they would either move them to a different plan or a different carrier, just so that they could process the agent of record change, regardless of whether they screwed the insured or not. Typically, it screwed them. They just wanted to collect the money. That's why I call them the rat agents. Now, a lot of them have been axed. A lot of the organizations that hired people to do this are getting shut down. They're getting sued. There's a big suit going on with about 4 or 5 of the major players that were doing that. And I know they've gone down, they've been suspended, and all the people that work for them are suspended. I've got an email from them saying, hey, how do I get my stuff back? And some of these agents didn't know better. They were just new hires. They didn't know that they were doing something wrong. But what do they say about breaking the law? Not knowing the law is not an excuse. So yeah, it is what it is. Hope that helps you out. So again, the only way that I know that they can steal is if and it's technically not stealing, if they talk to the insured and the insured tells them that they want the other agent. Again, it's going to have to come from the insured. All right. Pat the Fuse stuff. I don't even said that right. Okay. Pat the Fuse stuff. Maybe that's it. Okay. For ACA, if we have a customer who does not make a change for next year, do we get the renewal for that following year? Yes, you will. So we have a bunch of insureds and we don't get a hold of them. They change their number. They don't answer, whatever. If they renew, same company, in fact, even if they renew, let's say they go online and they process their own app and just renew. If they keep your agent information in there, you'll get it. Okay. If they go in there and they take your name off, you lose it. Okay. Yeah, just the way it happens, guys. So, but typically, yes, you will keep the renewal even if you don't talk to them. Very, very good question. All right, guys. Anything else? Hit me up. So, a couple of things. Ivan, will you post my email? In fact, I have my email ready to go. Here we go. Guys, here's my email. Prepare yourselves. You want to make sure you have all your carriers. If you're just an ACA agent, here's what you need to have. In addition to your ACA carriers, you need to have a dental and vision carrier. I use Emeritus. There's a bunch of them. I just use Emeritus. It's simple. They're competitive. They got a great plan. Very simple for you to enroll or for you to send a PURL to your insureds to enroll. If you don't have Emeritus, okay, email me and I will contract you for Emeritus. The second thing that agents need to have, besides their ACA carriers, their dental and vision carrier, is you need to have the indemnity carrier. I use Allstate. Email me and I will send you Allstate. Okay. The way I use that, guys, is every ACA plan is going to have an out-of-pocket maximum. I use the plan enhancer, which will reimburse the insured for an accident up to whatever benefit amount you choose. And you can add to that by adding a sickness hospitalization rider, which means if they're hospitalized for 24 hours, they write them a check for the entire benefit amount. That helps the insureds meet their out-of-pocket. If you don't have those two carriers, email me, please, and I will set you up. Emeritus, I'll send you a DocuSign. You fill it out and you attach your E&O and a voided check for direct deposit of your commissions. Allstate, I send you an email directly from them. On the Medicare side, you have your MAPD. You should be pairing that with a hospital indemnity plan, a HIP plan. I use Heartland National. There's other ones out there, but I love Heartland National. If you don't have them, email me and I will get you Heartland National. And the way I use that, guys, is you know that on MAPD, we have a hospital copay, an ER copay, and an ambulance copay. You can use your indemnity to meet those numbers for the insured. It's going to be dirt cheap, maybe $12, $14 a month for you to satisfy this, and this. Now, you don't make a lot of commissions on it. Okay, but it's something. It's two hooks into the insured. And you can set it at the time of the appointment. It's on the scope. Okay, then you can upsell that indemnity plan by adding cancer. With most plans, you know that therapeutic radiation either falls under a co-insurance of 20% up to the maximum out of pocket, or it's copays. So either way, they're going to probably hit their out of pocket. And you know, cancer doesn't have a calendar year timeline. Probably are going to hit two maximum out of pockets in 2 years. So if they have a $3,500 out of pocket times 2, that's $7,000. You can go on there and add cancer, and you can choose anywhere between $1,000 to $20,000. If you choose $10K right in the middle, which I always start off with, it's like an extra $30-something a month. And then I play with those numbers depending on what they can afford. So if you don't have Heartland National, email me and I'll get that to you. Okay. And then you should also have dental and vision for your Medicare beneficiaries. You don't necessarily need it for your MAPDs because they got dental already built in, but you definitely need it for your Med sub clients because there's no dental on that Medicare supplement. So you want to cross sell and add that. Okay, so hit me up, guys, and I will send you contract. Neil, do we need consent to put clients on auto renew? No. If you do not talk to them, you don't need consent nor confirmation. It just processes without you touching them. All right. Now, if you're going to touch them, you're going to review. Even if they are your client, you need consent. All right. So if they're your client, collect the consent, do your job, review it, update all the data, make sure everything is accurate. Research, you find a new plan for them. Awesome. Make sure you collect the confirmation of all the data and proceed. You need to do that with new people and your renewals. Good questions. Man, today's been great. All right, guys, I'm going to roll. Thank you so much for being on here today. I appreciate it. I will be back next Friday. I'm going to be continuing to do this for as long as I can. And again, email me. I will be posting a link today for the video that I'm going to be doing with Shauna on the Facebook ad course, and when we're going live with a $500 coupon, so you can get it for $9.97. That'll be today at come on, think. Today at 12 p.m. Central. I now have it posted out there. All right, guys. Again, thank you so much, and I will see you guys next week. Thank you, guys. Don't forget, I always forget this. Make sure you comment down below. I appreciate all of your comments and questions. Like this, give me the thumbs up. I want to push this out there. And finally, please subscribe to my channel. We're at almost 6,000 subscribers, 6,000 agents. So I'd like to get this to about 10 by the end of the year. So if you all know of other people that are in the business and hey, they want to jump on an open mic here, doesn't matter if you're my agent or anybody else's agent, I will gladly welcome you to this open mic call. All right. Thank you, guys. You all have a good one.